Good afternoon, everyone. This is Saro Arakelian, your clinical pharmacist. So, what is BERINERT or C1 esterase inhibitor? BERINERT is for hereditary angioedema, indicated for the hereditary angioedema. So, BERINERT is a plasma-derived C1 esterase inhibitor indicated for treatment of acute abdominal, facial, or laryngeal hereditary angioedema attacks in adults and pediatric patients. C1 esterase inhibitor, which is usually activated during the inflammatory process, inactivates its substrate by covalently binding to the reaction site. C1 esterase inhibitors, on the other side, is the only known inhibitor for the subcomponent of the complement, component 1C1R, C1S, and coagulation factor 12A and kallikrein. Additionally, C1 esterase inhibitor is the main inhibitor for the coagulation factor 11A of the intrinsic coagulation cascade. It's to be administered 20 international units per kilogram body weight. Excuse me. International units lyophilized concentrate is a single dose vial for reconstitution with 10 ml sterile water for injection. And you see, as you see over here in the image, it comes with the reconstitution sterile water for itself to be administered with its own sterile water in the package. Some of the warnings for this medication includes hypersensitivity reactions, serious arterial and venous thromboembolic events. Some of the adverse effects related to this medication, BERINERT, includes symptoms such as dyschezia, especially seen in patients taking it for the first time, and increased severity of the pain associated with HAE. So, again, this is a medication, another medication for HAE, just like Calbitor. It has its own adverse events, especially in those patients taking it for the first time. So again, this is a review on a medication called BERINERT, C1 esterase inhibitor for hereditary angioedema in adults and pediatric patients. It's a C1 esterase inhibitor, dosing of 20 international units IU per kilogram body weight. It's to be reconstituted with 10 ml sterile water that comes with it. And again, it's a medication to watch out for hepatotoxicity, hypersensitivity reactions, and serious arterial and venous thromboembolic events. Any unusual symptoms or adverse events is recommended for these patients to notice anything unusual after taking this medication and to report their healthcare provider for follow-up on continuing this medication or not. Hope you enjoyed this video. As always, stay safe and take your medications.